seconds of hand hygiene. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay, hello, my name's Nguyen. I'm gonna be your nurse today. I see you have some trouble communicating here, so I'd like to establish a nonverbal communication method with you. Is that okay? Basically, thumbs up for yes, thumbs down for no. Thumbs up? All right. I'm just gonna verify your identity really quick. Is your name John Smith, birthday July 7th, 1960? Double thumbs up? All right, good. I'm just gonna double check with our ID band here. Beep. And seems like everything checks out. Okay. Again, my name is Nguyen. I'm gonna be your nurse today. And today I'm gonna be performing a tracheostomy care on you. Have you had this procedure done before? You have? Okay. I'm just gonna give you a quick refresher here. Basically, I'm gonna be checking your lung sounds here, and if you hear any crackles or secretions, I'm gonna have to be using this suction catheter here to suction all the secretions out, okay? I'm also gonna be changing your inner cannula, cleaning up your faceplate here, replacing your gauze, and replacing your stabilizer, okay? Okay, well, before I can actually perform this procedure, I have a couple questions for you. Do you have any allergies? No? Okay. Do you have any pain right now? No? All right, do you have any questions for me? No? Okay. Well, if you have any pain or questions during the procedure, please let me know. I want to make this procedure as comfortable for you as possible, okay? Okay, well then let's check your vital signs then. All right, it's pretty normal, but I do see your O2 stats a little low. It's at 92%, and I do see some work of breathing here. So I'm probably, I'm going to be hyperoxygenating you during this procedure, okay? Okay. All right, last thing I'm going to do, I'm going to check your lung sounds, all right? Is that okay with you, Mr. Smith? It is? Okay. Now let's check your lung sounds, okay? I want you to give me deep breaths, all right? Deep breath, deep breath, deep breath, deep breath, deep breath, deep breath. Okay. All right, so I do hear some crackles and secretions, so I will have to perform some suctioning today. But other than that, let's get started. Hand hygiene for 20 seconds. Grab my gloves, I'm going to get my wipe here. I'm going to wipe this table down for 30 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I'm also going to close your curtains here for patient privacy. There we go. I'm also going to put you in high Fowlers, all right? Okay. Okay, that's okay with you, Mr. Smith? It is? All right. So while I wait for this table to dry for around 2 minutes, I'm going to be checking Mr. Smith's emergency supplies. All right. I see here 2 trachs, one on the current side, and one that's a little smaller. I also see that you have your ambu bag here. Just going to quickly test the functionality really quick. Working just great, at 15 liters at 100% oxygenation. Also see your suction canisters connecting to your suction catheter here, and it's set at 120 and 120. So that's really good. And I also see you have an extra inner cannula here, which is great. So it looks like Mr. Smith has all of his emergency supplies right here, and that's really good. All right, looks like it's been 2 minutes and this table is dry now. So I'm going to be removing my gloves, performing more hand hygiene, 20 seconds. Now I'm going to be moving my supplies onto this new clean table here. All right, putting my normal saline here, inner cannula right here, next stabilizer back here. Trach tray right here, and my suction catheter right here. Okay, let's perform more hand hygiene. 20 seconds. 20 seconds is up. All right. Get my new gloves, new clean gloves. All right, new clean gloves. Okay, Mr. Smith. Let's see what you have in the tray here, shall we? All right, I can see that we have some sterile gloves here, but we won't be using this for this procedure. And I see we have a drape here. I'm going to be careful to grab from the 1-inch border here. Okay, I'm also going to put it on this side. All right, Mr. Smith, you okay with me putting a drape on you? You are? All right. Drape has been placed. Okay. Next thing I'm going to do is I'm going to drop my inner cannula into the tray. Nice. Perfect. Also, next thing I'm going to do is I'm going to take this box here out of my suction catheter package. Perfect. Open my sterility or normal saline solution. Open. I'm going to pour halfway into this box here. I'm going to give some to my kid as well. All right, perfect. Okay, last thing I'm going to do, Mr. Sith, I'm actually going to change out your suction catheter here. Because I don't know how long it's been, I'd like to have for you to have a new suction catheter. Is that okay with you? It is? Of course. Who doesn't want a new suction catheter, right? Okay. I'm going to unscrew this right here. That's right here. Grab my new suction catheter here. Okay, now we got you a new spanking suction catheter. Isn't that nice? Of course it is. Who doesn't want a new suction catheter, right? Okay, I'll be testing the functionality of this later. All right, next thing I'm going to do is I'm going to hyperoxygenate you now, okay? All right, well, before I can do that, I have to change my gloves here. So I'm going to do hand hygiene for 20 seconds. And put on my new clean gloves. All right, my new clean gloves are on. So let's get started. All right, so I'm just gonna remove your O2 source here, pulling your faceplate down for stability. Grab your ambu bag here. All right, so let's just quickly test the functionality of this one more time. Working just great, and is at 15 liters? That's perfect. Okay, let's hold your stabilizer here down, or faceplate here to keep it stabilized. And I just want you to breathe normally for me, okay? Okay, so I'm gonna give you a couple breaths here. I'll give you 2 to 3 of them. All right, 1 breath. 1, 2, 3, 4, 5, 6. 2 breaths. 1, 2, 3, 4, 5, 6. And another breath. 1, 2, 3, 4, 5, 6. Okay, how do you feel, Mr. Smith? Feeling a lot better? Okay, and it looks like you're looking a lot better too, because your O2 status is on that 98, so now we can perform some suctioning. Isn't that great, Mr. Smith? Any shortness of breath? No? All right. Then let us commence the suction catheter. All right, going to give a couple inches here. I'm going to be also testing the functionality of my suction catheter here. All right, it's working just great. Perfect. Okay, Mr. Smith, are you ready? You are? Okay, remember, if you have any discomfort, please let me know. A couple inches right here. Okay. I'm going to be inserting, okay? Ready, Mr. Smith? All right. Oh, okay, I hear you coughing. Start removing it now, okay? Okay. All right. Hey, good job, Mr. Smith. So how do you feel? You feeling a lot better? Okay, I noticed that your O2 stat's still 98, so we won't be needing to hyperoxygenate again. So how do you feel, Mr. Smith? You want some more suctioning? No? Okay. Well, if I was going to suction again, I'd wait 30 seconds. But since Mr. Smith is feeling a lot better, I do not need to suction again. Also, I'm noticing your chest here, and it looks like the work of breathing has decreased. So that's really good. All right. Next thing I'm going to do is going to change your inner cannula. Okay, Mr. Smith? All right. He's okay with it. Well, I'm going to be changing my gloves off again. And hygiene for 20 seconds, like always. 20 seconds. All right. Let's change your inner cannula, okay? So I'm going to be holding down your faceplate here. And then be removing your O2 source. Okay, so let's get your new inner cannula, okay? Slowly removing it. That's right. Making sure to grab this by this end, very carefully. All right, I'm going to be inserting a new inner cannula, okay? Okay. Okay, I'm also going to be securing it with the wings here. Okay, okay. Also going to be removing your dressing here. Perfect. And I'm looking at the site right now. I don't see any redness or swelling or sign of infection, so that's really good. Okay, so just going to be replacing your O2 source really quick. All right, so Mr. Smith, next thing I'm going to do is I'm going to be cleaning your faceplate and actually just the site in general, okay? Okay. All right, let's do this. All right, I know I just placed your O2 source, but I will be having to remove it again, so. Okay, first things first, secure faceplate. And I'll be grabbing cotton swab here. Dip, 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 dip. Perfect. Okay. Let's clean under your faceplate here. One swipe. Perfect. Grabbing another one. Dip, dip, dip. Lifting your faceplate just a little bit here, just to get to the other side. One swipe. Okay, perfect. Grabbing myself a gauze dressing here. Dip, dip, dip. First getting the under edge of your faceplate. Perfect. Grab another dressing here. Dip, dip, dip. And we're going to be the upper edge of your, the under edge of your upper side of your faceplate here. Okay, perfect. Next thing we do is dip one more dressing here. Dip, dip, dip. And I'm going to be cleaning the top side of your faceplate now, all right? Clean, clean, clean. Clean, clean, clean. Gonna hold this side now. Clean, 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 clean. Great. Now with this new gauze, I'm gonna be drying your faceplate, okay? Okay. Pat, 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 pat. Hold to the side, pat, pat, pat. Okay. Nice and dry, okay. Looking pretty dry and intact. I don't see any skin breakdown. All right, I'm gonna be using this new split gauze. I'm gonna be putting it under your faceplate, okay? Okay, so I'm just gonna be securing your faceplate really quick. Being very careful. Okay. Very good, Mr. Smith, you're doing really well. Okay, how was it, Mr. Smith? Good? Feeling clean again? Great. Well, this is the part where I'm gonna be calling my coworker in, because I need I need another person to help me remove this stabilizer, okay? Okay. So I'm going to be grabbing my nurse here. I'm going to be putting you in lowest Fowler's position. Okay. Putting your call light right here if you need me. But don't worry, I'll be back soon. Putting your side rails up for safety. And I'm going to be leaving. So do you have any questions for me before I leave, Mr. Smith? No? Okay. And you're feeling a lot better right now? You are? All right. Again, your vital signs are good. 98. All right. I'm just going to be grabbing another nurse, okay? Okay. Just gonna take my gloves here. More hand hygiene, like always. 20 seconds, and now I'm leaving. Okay, Mr. Smith? Goodbye. Hand hygiene, 20 seconds. Oh, hello, Mr. Smith. How are you doing? I know it was a little bit, but I'm back now. Was that too long for you? No? Okay, great. Looks like I was back in time. All right, I brought my other nurse here. His name is Mr. Harambe, and he will be holding down your faceplate for me. He has already done his hand hygiene, new gloves, and he has his face mask and new mask, okay? I'm also going to be putting my gloves on. So, Mr. Smith, are you feeling better? You are? Great. Any shortness of breath or cough? No? Okay, I'm just going to double check your vitals here. Looks like it's 98. So that's still stabilized. That's really good. So let's get on to changing your next stabilizer, okay? All right, looks like he's ready. So first thing I'm going to do, I'm going to hold down your faceplate with my other nurse here, and we'll remove your O2 source. I'm going to ask my other nurse to hold down the faceplate now. I'm going to prepare this new necktie here. Just prepared. I'm going to be removing your old one now, okay? All right, Mr. Nurse, hold down that other faceplate for me, okay? Thank you. Keep holding it down. Perfect. I'm going to check the site here. I don't see any signs of infection, no redness or swelling, or even any skin breakdowns. So that's really good. I'm going to bring in my new necktie here. Keep holding down that side of the faceplate for me, okay? Okay. Thank you. All right. Nice and easy. Nice, very nice. I'm going to be pushing this under the pillow. I'm going to be asking my other nurse to grab it for me. Other nurse, how's the side of the neck? All right, no swelling and no skin to break down as well? That's great. Okay, I'll just push the new one down the other side as well. Okay, now I'm going to be the one holding down the faceplate, and my other nurse here is going to be removing the old necktie. So I'm holding down the faceplate. My other nurse here, okay, my other nurse will be holding down or be changing the necktie while I hold down the faceplate, and I will dispose of this for him. All right, go ahead. Put the new one on while I hold down the faceplate. Okay. Great job. All right, Mr. Smith, how you doing? Still okay? Still good? Great. All right, let's just do a two-finger technique here. All right, nice and snug. Okay, I'm just going to replace your O2 source now. All right, Mr. Smith, how do you feel? Feel good? Feel better than before? He does. Great. All right, so I'm going to double check your vitals again. Again, everything's still stabilized, 98% on O2. I'm going to dismiss my co-worker here because they have done their job greatly. Thank you. All right. That's great. So I'm just going to be disposing of my supplies here, okay? In the appropriate receptacles. Also going to be disposing of your drape here. All right, before I go, I will have to check your lung sounds one more time. That's okay with you, Mr. Smith? It is? That's great. All right, I'm just going to check your lung sounds then, okay? Deep breath, deep breath, deep breath, deep breath, deep breath, and deep breath. Perfect, Mr. Smith. All right. So, how are you feeling right now? Feeling better? Good, okay. Well, I'm going to leave this call light with you here. I'm going to assure that this is a new suction catheter that I put in. And I'm going to be documenting the date and time of this procedure, my patient's tolerance. Does you tolerate okay? He did. Okay, great. And I'm going to be documenting that the fact that I performed this tracheostomy care. You know, I cleaned his faceplate and replaced his gauze and stabilizer here. I'm also going to be documenting the amount of sputum, the color, and the consistency of the sputum that's in this canister here. I'm also going to be documenting your vital signs, your O2 signs, and your respiratory efforts. And I can see that there's a decreased work of breathing, so that's really good. Okay, Mr. Smith, I'm going to lower your bed to the lowest position. All right, so if you have anything for me, again, your call light's right here. And if you have any questions or concerns, please let me know. Okay, Mr. Smith? All right, so I'll be on my way, and I hope you have a wonderful night. I'm going to be leaving now. Let me just take off my gloves here for more hand hygiene. 20 seconds, and I am gone. Have a good night, Mr. Smith.